I don't know whether it's, well, I think it is obvious why people are frustrated with Rishi Sunak's approach at the inquiry into infected blood. This is an inquiry that really is so long overdue it is farcical. The infected blood was given to people in the 1970s and the 1980s, and the Council for the Department of Health and Social Care for England has declined a request from the chairman of the public inquiry to say what had gone wrong in the department's handling for the supply of blood and blood products in the 1970s. Um, it's just, it's just loopy, and the Prime Minister was unbelievably evasive in his response. I should put my cards on the table. I have my own axe to grind here, in a sense, because I'm incredibly lucky. For some bizarre reason, I was not given blood products in the 1970s and the 1980s. And I think I only began to have blood products later. I thought I was being given some sort of medicine. I wasn't. I was actually being given blood products, and it's only very recently that I was given artificial products. And I simply didn't know. Even when I was given blood products, I didn't know. They didn't look red. They didn't look like blood products, but they were. And so I'm very sympathetic to people who have been given blood products because, frankly, even now we have more information. Even now I wasn't told. And so if in the last 10 or 15 years people like me were receiving human blood products and didn't know how much worse would it have been like in the 1970s and 80s. So I'm on the haemophilia scale. So as I say, I'm incredibly lucky that I wasn't being pumped with blood products at the height of this scandal. For some reason, I avoided it. For some bizarre reason. And I think part of that is because when I was at school and forced to play rugby and do ridiculous things, although the school probably knew what my condition was, and the school nurse kept giving me aspirin, which was just ridiculous as well. I didn't like rugby. When the ball came anywhere near me, I used to run away. So I avoided most of the issues connected with haemophilia. I just simply didn't have them. And my condition was constantly being diagnosed as something slightly different on the spectrum. Each time I went for a review, I ended up with a slightly different diagnosis. And yeah, it's. I think I've been very lucky, but it's chance, and certainly not the advocacy of the government or the competence of diagnosis. It's pure chance, and I can well understand, and I'm very sympathetic to those people who are frustrated by the evasion of the one area that we could get right. The government is in complete control. The NHS is in complete control of reviewing its own failures. And yet that's an area where it doesn't want to go because it knows that's simply going to cost money. We could even draw a line under it and say, from now on, we're going to do better. But I have very little belief that's going to be the case, because the problem is not the treatment. The problem is not the care. The problem is the bureaucracy. And so much time is wasted in redefining which area I, for example, belong to, which category I should be in. Who cares? Who cares? I have a bleeding disorder. And I have, in fact, received very good treatment for it. But I've never quite known what treatment I was getting. And that is the same for almost everybody else, and particularly for people in the 1970s and 1980s. The NHS thinks it knows better, and when it gets it wrong, frankly, it should stick its hand up and say it got it wrong. The better situation would be to share this information at source, to give us information so we weren't being treated as idiots and as pawns in a much bigger game. The arrogance of medicine, the arrogance of the government, that is what is exposed at this moment. And dithering and saying, like somebody searching for lavatory paper on the loo. It's just not, it's not dignified from our Prime Minister, and it's not appropriate.